Hi everyone, welcome back to Natura Excel. Today, we're diving into a topic that many people wonder about but don't always talk about: semen leakage after intercourse. Is it normal? Does it affect fertility? And what can be done about it? Let's break it down with some science. Why does semen leak out after intercourse? Semen leakage after intercourse is something most people experience, and it's completely normal. Here's why it happens. When a man ejaculates during intercourse, he releases semen, a fluid that contains millions of sperm. This semen is deposited in the vagina, but not all of it stays there. The vagina is not a sealed environment. It's open at the vaginal opening, so some of the semen naturally flows out. Gravity plays a big role here, especially if the woman stands up or sits down after intercourse. The semen that remains in the vaginal canal will eventually leak out. Now, you might be wondering, does this mean sperm aren't reaching the egg? The good news is that even with leakage, enough sperm still make their way through the cervix and into the uterus. Only a small number of sperm are needed to reach the egg for fertilization to occur, so leakage doesn't prevent pregnancy. Let's talk about how body positioning affects semen leakage. After intercourse, the position you're in can influence how much semen leaks out. If you remain lying down after sex, especially with your hips elevated, gravity helps keep more semen inside the vaginal canal. This can give sperm a better chance of reaching the cervix. Some couples trying to conceive find this helpful as it maximizes the retention of semen. However, it's important to understand that even if you stand up right away, sperm are quick to move toward the cervix. In fact, sperm start swimming toward the egg within minutes after ejaculation. So while positioning can help reduce leakage, it's not a deal breaker for conception. Now, you might be concerned that semen leakage could affect fertility. But here's the science. Even if some semen leaks out, it doesn't necessarily mean your chances of getting pregnant are reduced. The consistency of semen changes after ejaculation. Initially, semen is thick, which helps it stay in place within the vagina. After about 15 to 30 minutes, it liquefies. This process, called semen liquefaction, allows sperm to start swimming toward the cervix and uterus. Remember, it only takes one sperm to fertilize an egg. Even with leakage, millions of sperm are still released, and some will always make it through to the cervix. This is why many couples conceive without even thinking about semen leakage. While semen leakage is normal, I know it can be a bit uncomfortable or concerning for some people. So here are some tips to manage it. Body positioning. As I mentioned earlier, staying in a lying position for about 15-20 minutes after intercourse can reduce leakage. Elevating your hips with a pillow might also help. Pelvic floor exercises. Strengthening the pelvic floor muscles through Kegel exercises can improve muscle tone and may help with controlling the flow of fluids after sex. Hygiene practices. After intercourse, gently wiping away excess semen can help with personal comfort. Some women also use panty liners or tissues to manage any leakage. If you're trying to conceive, these techniques can give you peace of mind, but remember that leakage doesn't mean something's wrong. In most cases, semen leakage isn't a cause for concern, but if you're experiencing additional symptoms like pain, discomfort, unusual discharge, or if you've been trying to conceive for a year without success, it's a good idea to see a doctor. A healthcare provider can help determine if there's an underlying issue that needs to be addressed, like an ejaculatory disorder or pelvic floor dysfunction. For couples struggling with fertility, a specialist can offer targeted advice and treatments to help increase the chances of conception. It's always better to seek guidance early rather than worrying in silence. Thanks for tuning in to today's video. I hope this breakdown of semen leakage and its impact on fertility was helpful. Remember, it's a normal part of the process, and there's usually nothing to worry about. If you have any questions or want to share your own experiences, feel free to drop a comment below. Don't forget to like, subscribe, and hit the notification bell so you don't miss our next video. Until next time, take care.